Important time of the year that highlights men's health for a month. Joining us today to talk about the importance of No Shave November is Dr. Bieniek, the medical director of men's health at Tallwood Urology and Kidney Institute. Doctor, welcome.
Thank you for having me.
Great to have you. So what is the importance of No Shave November?
Well, I think after the weather report, besides a good response to snowy, cold weather in Connecticut, it's really about men's health awareness. And that's what November is. It's a month for men's health awareness. And so that can be expressed in a lot of different ways. Some individuals may be growing facial hair, whether it be a beard or mustache. And many of my female colleagues will also either use paste on mustaches or also can use the app's filters to put on their own facial hair. And it's really about starting a conversation surrounding men's health.
All right, doctor, how does the recognition impact men and their health?
Well, I think the recognition, it's really about starting conversations and taking stock in healthcare engagement, specifically for men. So for men, that's personally, have you seen your primary care provider? Are you up to date on your screenings and other healthcare concerns? And then also really looking at friends and family. Has your loved one seen his physician? Have other family members seen their physician? Are they up to date with their colonoscopies? Have they begun working on their weight ahead of the holidays, et cetera? And then as a healthcare provider, it's also a reminder to myself and many of my colleagues that we need to look at men as a whole and recognize that many of the disease processes we see are really just a subcomponent of an overall condition, and recognize that those interdisciplinary concerns need to be addressed from a multidisciplinary standpoint amongst a group of physicians.
Doctor, why is there such a lack of awareness around men's health?
I think the lack of awareness occurs at a couple different levels. Certainly from a top-down look, there is no national agency that's pushing an agenda towards advancing men's health. The National Institutes of Health does have an Office of Research on women's health, but there really is no male equivalent. And then at the lower level, at an individual level, we know that men are less likely to engage in preventative health care. And we've looked at focus groups, and there's a number of reasons why. One, just being a natural male personality. If it isn't broke, don't fix it. That stoicism and tough personality where they may not want to see physicians. But I will constantly remind men, it may be the sign of something else, a canary in the coal mine, as we would say in Western Pennsylvania. And so it's really important to get those things checked out.
All right, doctor, brief last question. What do you want men to know during No Shave November?
Well, I think there's a couple of main issues that I've really been focused on over the past year. Number one is really looking at weight and how that's linked to many of the conditions that we see. Mental health, more and more attention being focused on that. And then looking at really equity and how we're providing better care. There's life expectancy differences of over 15 years in some regions of Hartford, and I think we need to look at how we can better address that.
All right, Dr. Bieniek, Medical Director of Men's Health at Tallwood Urology and Kidney Institute. Thank you for being with us and educating us on Movember.
Thank you for having me.